Dr. Fennell, I'm tired of explaining OLIF and its benefit. Why don't you take over?
All right, well, I'm an orthopedic surgeon. I've been a clinical teaching professor for over 30 years now. I focus mostly in my life now on upper extremity work, but I have in the past done spine surgery. And I've watched the evolution of spine surgery now take place over the last 3 decades. We have seen the transformation in our facility of open back procedures, open fusions, procedures done with anterior and posterior techniques, to this new OLIF concept presented by Dr. Abbasi. There's been a lot of detractors thinking that the technique that he's describing either can't be done or doesn't have the results that he has been portraying. I'll give him his credit. He's been watching his cases prospectively for the last decade. They're up over 1,500 cases, and approximately half of those cases have been done in the facility where I've had a chance to watch it evolve over the last decade. So in my role as the chief of surgery and the chief medical officer of this hospital, I've had the responsibility of making sure that outcomes are as good as what have been advertised. What I've seen happen is we've seen major spine operations now being able to be accomplished in a small, rural, northern Minnesota hospital. We're a 25-bed hospital with limited resources, which makes it imperative that we do these things safely. And we've been able to now accomplish doing major spine operations, including multiple level fusions, where Dr. Abbasi and his colleagues are using these techniques. I've seen operations that typically in the past have been taking surgeons upwards of 6 hours to do single level fusions are now being done in our facility in 35 to 45 minutes, with the patients going home either the same day or the next day. Now, we've been very fortunate watching how this is evolving, and as the chief of surgery, one of the things I'm most cognizant of are the complications that take place. So some of the things that have classically taken place with these spine patients are things like DVT, dural tears, pulmonary emboli, things like that that occur. The infection rate for this case in our facility has been 0. There's been no infections at all over the last 8 years using this technique. We've had no cases of takebacks to the OR for dural tears. So we've been extraordinarily happy with how these patients have been turning out, and it is a revolution in how spine surgery is taking place. There's just no doubt about it. We're doing bigger operations on older individuals with better outcomes. Now, for those who think that this is crazy, think back to Australia and one of the doctors in Australia who took 10 years teaching the world that there was problems with how we were treating gastric ulcers. It took 10 years for people to actually believe that this was an infection-based thing. So anybody in Australia who thinks that maybe the truth isn't being told here,